You have a patient who's admitted with recurrent hernia, inguinal hernia, and he's legally blind, walking stick and dark glasses from cataract, and patient had mechanical heart valve replacement and is on warfarin and is planned for an operation, and he was asked to stop his warfarin. However, the patient is quite worried because he was told before never to stop this medication, and it's crucial to him. Would you like to discuss with patient that? That's okay.
Okay. Good morning. I'm Dr. Ali, one of the exam candidates. Could I confirm your name and age, please?
Hi, Dr. I'm Abdullah here. I'm 55.
Okay, nice to meet you, Abdullah. Today, I would like to discuss you about your blood thinner that you use. Can you tell me first what do you know so far about your condition?
Well, I know everything about my condition, really, doctor. I'm quite confident and uncomfortable with taking that medication. So I've been taking warfarin for years and years now because I have a mechanical valve that was inserted years ago. And since I've been taking this, since I had the mechanical valve replacement, and I was told never to stop this medication, and if I ever do, I will be at a higher risk of having a stroke and maybe a blood clot as well. And I don't want to have that. So I was told by one of your colleagues to stop the medication, and I'm not really convinced that this is the right advice for me, given that I have a mechanical valve and I'm at a higher risk of having blood clots.
Yes, that's right. Blood thinner, like the one that you use, it's used to prevent the blood clot formations, which can harm the patients in many ways. We can offer for that in surgery. In surgery, the bleedings can result as complications in patients who has used blood thinner, but we can handle that and optimize the blood thinning effect of the drugs, and in the same times that we prevent the clot formations. We can stop that drugs and give you alternative drugs that we can control it, because the one that you take it can be associated with more bleedings that is difficult to control. After operations, we can you can return back to your usual medications after you can take oral intake, and we are satisfied with your wound.
Well, yeah. Well, doctor, I'm not sure if this is convincing to me, really. So basically, you said that I will have to be off this medication to avoid me bleeding during the surgery, but you're going to put me on a different medication that's, again, a blood thinning medication. So I don't really get it. What's the actual difference between them?
Yes, the actual difference is that the alternative will be able to be controlled and controlled I mean the bleedings controlled with the alternatives. And after surgery, you can go back to your usual medications once you are able to take oral intake.
Yeah. All right. So you said I'm going to go back to warfarin after the operation.
Yes.
And when is that? Is it first day after the operation?
Well, it depends on type of surgery and the ability of the patients to take oral intake. Once the patients will take oral intake, we will start your usual medications. We will also continue our alternatives until we checked the specific test that used to monitor the bleeding tendency and the effect of the blood thinner. once it's in a target range, we will stop our alternative and you can continue with your own blood thinner drug.
Okay. Fine. Okay, thank you. So yeah, I think you were still behind the 9 minutes. But to be honest, Ali, I'm not very happy with the explanation that you made. I'm going to give you a bit of advice. That is, when is your exam, by the way?
26th of April.
This April, right? So in 26 days, or maybe
Yes.
23 days. Okay, that's fine. So Ali, I do understand and I do appreciate that the English is not a first language for you, which makes it a little bit tricky to explain things. I was in the same situation years ago. So I would say what you need to do is to actually start writing the answers, right? So just try to write the answer and read it, or even record to yourself and see if this is an adequate explanation for you. I felt like you were taking longer time to explain things, and at the end, the explanation was not really adequate. Okay, so for example, I told you I'm currently in Warfarin, and I was asked to stop, and I'm not really convinced that this is the right thing. So first of all, you need to acknowledge what I'm saying. Just say, I do understand what you're saying, and I understand, especially in patients with mechanical valve, warfarin is extremely important medication. But here we have a different scenario. I'm not taking warfarin off you forever. So let me explain to you, and then I start explaining nicely what's actually happening. So start by talking, okay, so first let's talk about warfarin. It's a blood thinning medication, like you said. It does increase risk of bleeding, and having surgery will even further increase the risk of bleeding. All right. So, and something to know about warfarin, which I'm sure that you might know, is the half-life of warfarin that lasts in the body is about 3 days. So it's a very difficult medication to reverse, to make sure that you're having a standard risk of bleeding just before the surgery. So what we're gonna do is, just 5 days before the surgery, we're gonna stop the warfarin and put you on a different medication that has less half-life of 6 to 12 hours. So it will be easy to have an operation in a safer window for you with a lower risk of bleeding, right? So you're trying to break it down into pieces. One, let's talk about warfarin. And I'm gonna mention 2 things about warfarin. It's a blood thinning medication with prolonged half-life, about 3 days. Okay. 2, let's talk about the alternative. You kept saying the alternative, but you never actually meant it. You never actually said it, right? So the alternative is a low molecular weight heparin, which is a small injection in your tummy, right? And the half-life of that medication is 6 to 12 hours. So it's good that we can reverse it easily, and we can have an operation in a safer window, all right? That's the first bit, that you need to make your communication clear. Try to signpost. Don't be monotonous. Try to say, like in the important bits, try even to use your hand gestures. So let's first talk about warfarin. And I'm going to mention 2 things. It's a blood thinning medication, and it has a prolonged half-life that lasts up to 3 days. And this makes it very tricky to control the bleeding during surgery if you are on warfarin. So we'll have to be off warfarin for at least 3 to 5 days. Okay, and then the other medication is low molecular weight heparin, injection through your tummy with half-life of 12 hours, etc., etc. Okay, that's how to explain this bit. All right, what's the difference between the medication? I mean, I asked you very clearly what's the difference, and I didn't get it at the end. So you want to say the half-life. This medication, it takes the body about 3 to 5 days to clear, and this medication, it takes the body 12 or 6 to 12 hours to clear. This is what you want to say. Will you start me later on warfarin? Yes, by all means, you have to be in warfarin. Like we said, it's a crucial medication for patients with metallic valve replacement. So yeah, you will have to be on it. We're gonna start you as soon as you're able to eat and drink after the surgery. All right. So usually will be 2 to 3 days. You can here mention the bridging as well, because you will have to keep them on the low molecular weight heparin for 3 days until the warfarin, the bridging is done, right? So you can mention it here. Yeah, after the operation, you will be in warfarin. You will take it as soon as you're able to eat and drink. However, you will have to continue on low molecular, on the injections in your tummy, because it takes the warfarin 3 days to build up in your blood and increase to a level that's able to actually thin your blood. Right? When you say that is done, scenario is done, I wouldn't ask you any further questions. Okay? So I do understand here what the difficulties for an international graduate that's the English is not first language. I'm one myself that I've faced that before. So what I'm trying to say is take your time in writing the answers. But that really helps, or recording to yourself and listen to yourself and see what you're saying, if it's sort of clear or not clear, right? It might be a lot of work, but if you don't do that, your communication in the exam will be very tricky. And communication in the exam is extremely important, because it's not only 2 scenarios, it's about 15 scenarios. All right. And what I mean by that is your communication is being assessed in pathology and acute care and history taking and everything, right? So you want to make sure that your communication is very, very clear.